Many of you guys know October is Breast Cancer Awareness Month, and I thought it was really important to sit down with Dr. Karamardian and talk about knowing our bodies, the signs and symptoms of breast cancer, and early detection and how important it is. It was such a shocking thing for me, but 1 in 8 women in the United States develops breast cancer. And it is so incredibly important to know your body, the signs and symptoms, and going to your doctor and making sure you get your checkups.
Also, we need to be aware of the fact that while we're diagnosing more and more women with breast cancer, we're actually diagnosing them at earlier stages. And so breast cancer isn't the death sentence.
And there's more survival.
Exactly, exactly. And so the key is exactly what you're talking about, is early diagnosis and being aware of what you can do to maintain your health and all of the options that are available to you. So
what do we need to look for?
Right. Instead of fear, what I like to teach my patients is a healthy awareness so that they can actually get the best care possible. So first of all, you talk about self-exams and stuff. So now to me, that's an area where I think there's a lot of misinformation for women. It's like, do a breast exam every month, and and if you need to do this to feel something, and you go to your clinician. And again, I feel that's an area where guilt gets put on a woman that, why didn't I feel this sooner? Why didn't I pick this up? And really what you need to understand is that a self-breast exam is not the important part, but breast self-awareness is. And so when my patients come in, and starting at age 20, when they come in for exams, I want to teach them how to do a breast exam, but not because the burden is on you to diagnose your breast cancer, but because I want you to be aware of your breast health. I want you to be aware of the changes that happen to your breast, and I want you to be aware of when to come in and alert me because you felt something. The truth is by the time you can feel a mass or a lump, it's already been there for a while, right? Oh. So detection and early prevention and early diagnosis and all of those things, there's a lot that goes into that. So from a patient standpoint, you want to be able to be aware of your breasts. You want to know how to do an exam, and you want to be able to be aware that your breasts have changes throughout the entire month as you're cycling.
What is not normal when we look at...
You want to test your breasts at the same time every month. So I tell my patients that if you are going to do a breast exam, the best time to do it is right after your menstrual cycle, or 3 to 5 days after you've started. Your breasts are least tender at that time. Any lumps or bumps that you feel at that time, you can correlate them if you have been checking your breasts at the same time of the month. Women that are in the menopause, you say pick a time of the month and check it at that same time. But the idea is to be aware. If you check your breasts throughout the entire month, especially someone young and healthy like you're going to see all these hormonal changes, and you're going to see things that are the normal cyclic changes of your breast. And so that's why checking at the same time of the month, right after your menstrual cycle, is the best time to actually do that exam.
I had no idea, and that is great advice for us.
It's also least tender. So I teach my patients when they come in how to do a breast exam. You want to use the pads of your fingers. You want to go up and down to make sure that you cover the entire breast. You also want to, or you could go around in a circle, but you want to cover under the areola and the nipple area too. So you want to feel, and up under the arm too, because there's breast tissue that goes up into the axilla. So making sure that you check the entire breast, again, when you're alerted to something that's new or different. But again, if you check at the same time, you'll notice that something is new or different, right? Exactly. But if you check throughout the month, you're going to get scared. You're going to notice lumps and bumps that are normal hormonal changes that go with your menstrual cycle. The other part of breast health would be going in to see your clinician and getting clinical breast exams. And so when you come in, your physician will examine you. They'll teach you how to do these exams, and they'll alert you to what can be very normal findings in your breasts or what would be something that would be a change. And then the final part of it is the diagnostics, right? So now we have 3D tomosynthesis, and that's a more sensitive mammogram. And that's really why we're getting this early detection of breast cancer, and we're finding these breast cancers so early. But the idea is to make sure that you stay on top of your screening. That's the most important thing. So women over the age of 40 should be having a some form of imaging done every year.
That was a question of mine because you hear a lot of different things. You're hearing 35 now, you're hearing 40, 45. So yeah, so 40 is a good time.
So again, family history and personal history is key. So what you want to be aware of is, if you have any first degree relatives. So a woman who has a first degree relative, and what do we mean by that? First degree relative is a mom, a sister, an aunt, someone that has a breast cancer, that doubles a woman's risk of breast cancer. Now, if you have 2 first-degree relatives that have breast cancer, then your lifetime risk is tripled. So you want to be aware of those statistics, and that's going to factor into timing when you tell an individual. What was the age of those individuals when they were diagnosed with their breast cancers? So when you come into your physician's office, you really want to have that family history. You want to know that information. Have you personally had any breast biopsies before? All of those are factors that go into play for us to figure out your risk of developing breast cancer.
So you really need to know this information to give to your doctor. Something that I went through with you when I first came to see you, I let Dr. Karamardian know my aunt passed away from breast cancer, and then my grandmother on my father's side passed away from ovarian cancer. The first thing Dr. Karamardian did was give me a test, the BRCA test. And do you want to get into that?
Yeah. So genetic testing, again, the majority of breast cancers are not they're found in individuals who don't have a family history.
Wow.
But again, when we are alerted to the fact that you do have a family history, then that tells us that we can send you to a genetic counselor and have testing done to look for some of these gene mutations that we know give you a higher risk of developing breast or ovarian cancer. And BRCA1 and BRCA2 are examples of that.
Yeah, so I discovered I did not have that genetic mutation. Thank God. But it was good to know. And, Angelina Jolie is famous for, having her breasts.
She did a double mastectomy, as prophylaxis to prevent her future risk of developing breast cancer.
We don't really know when to start getting our annual checkups, and it's so important.
It's a great question.
When do you recommend a woman starting to get her annual?
The official recommendation from ACOG is to start annual screening exams with your obstetrician gynecologist at age 21. Or when you become sexually active, whichever comes first.
Okay.
Depending on if a girl is having issues with her menstrual cycle, we'll see them sooner. If they need birth control, if mom thinks they're sexually active and they just need someone to come in and talk to and be able to, just make sure that they're staying safe. And so really it depends on the individual. But if you're not sexually active, then we'll start those annual screening exams at age 21.
What do you do during an annual screening?
Again, depending on the individual and their lifestyle. So if they need to be screened for STDs, we'll do that. At age 21, we start doing pap smears for those sexually active women. And then teaching a self-breast exam, teaching individuals how to do that exam so they're comfortable with examining their breasts, they're aware of their menstrual cycles, understanding their birth control and how it affects them, making sure that they're staying safe. We have to be concerned. There's a lot of violence out there now, especially directed towards women, and you want to make sure that they're in a healthy, nurturing environment, and that whatever decisions they're making, that they are in control of that. And so just letting them know that they have an ear that they can talk to and someone that they can get advice from. And a lot of times it's just making sure that you feel that they're safe.
If you do have a close relative that has breast cancer, had breast cancer, how often should you get your mammogram or screening done?
When you take into account a woman's age, you take into account her personal history as far as screening goes for prior imaging and any prior biopsies, and then you look at the number of first-degree relatives or second-degree relatives, and then you'll calculate someone's risk. So, for example, I have a lot of high-risk patients that either have family histories or they've had multiple biopsies or things that have happened themselves, then that puts them in a high-risk category. So for most high-risk women, we'll recommend a mammogram be done once a year, but they'll also recommend that an MRI be done once a year too. We generally will stagger those at a 6-month interval. So that way they're actually doing the mammography once a year and the MRI once a year, but they're staggering it so they're getting some form of imaging every 6 months. And that's generally what we do for women who are very high risk.
Are there any triggers, like environmentally, that can bring on breast cancer?
Great question. So we do think that there are some environmental factors and also lifestyle factors that can come into play. So alcohol consumption is probably key. That's one of the number one things that we think is related. So smoking, alcohol, a lot of those kind of factors can really play a difference. A healthy lifestyle is going to make a difference. Your weight and diet, and that can have a factor in it.
What would you recommend to your patients the amount of alcohol to consume in like 1 week? What is the healthy amount?
We've never really studied safe amounts of alcohol, but I think as in anything, moderation is key. What has been studied is actually that binge drinking is actually sometimes more harmful than just the occasional drinks that you could have, say, on the weekend. So, but individuals who will have a drink every night or binge drink, that's generally seen to be more harmful than just the occasional 1 or 2 drinks on the weekend. So moderation.
So, interesting. So genetics and environment are the causes of breast cancer. Yeah. One more question. Can you find out that you have cancer through a blood test? Say you go in for your annual pap smear and you get your blood taken and you want to know if you're deficient in anything. Can you find out that there's something going on in your body that is not right?
We don't really have any screening modalities that way yet, or to be able to detect that type of cancer. It really is the whole picture that your doctor has to put together, and usually, generally, it comes down to imaging studies, but there isn't any one blood test per se that's going to say, there's cancer here, we need to look for it. Yeah,
that's good to know.
There are tumor markers, but they're generally specific to once you've already identified that there's something there and you're trying to figure out what type of a cancer it is.
Okay, well, thank you so much for being here. We learned so much about breast cancer. Just make sure you are giving yourselves breast exams, going to see your doctor. If there's any signs, any symptoms that don't feel right, go to your doctor, get checked, and be healthy. Get your mammograms, starting at 40.